In fact, for the month of October, we're going to be observing Mental Health Awareness Month in South Africa. The World Foundation of Mental Health says this year's theme is mental health is a universal human right. The objective is to educate the public about mental health and reduce the stigma and discrimination that people who are mentally ill are often subjected to. According to the latest UNICEF South Africa U-Report poll, some 60% of children and youth felt that they needed mental health support over the past year. Mental health remains a universal human right. So to take this discussion further, we're going to be joined via Teams by Toby, Chief of Communication and Partnerships at UNICEF South Africa. Toby, good afternoon, and thank you for your time with us here on the SABC.
Hi, good afternoon. Thanks so much for having us on.
Perhaps you could talk to the strides that have been taken to date and what more needs to be done in South Africa's context as we shine a spotlight on this month.
Yeah, so this latest U-Report poll was interesting, actually, because it showed, like you said, 60% of young people, of respondents, stated that they felt they needed some form of mental health support over the past year. And actually, we did a similar poll this time last year, which showed closer to 75%. So we've seen a drop. Now, does that suggest that there's an improvement? I mean, we can't say that for sure. But it does suggest that fewer people this year, at least, have said they felt they needed specific support over the past year. But we also see variance at different age groups. So between the 15 to 19-year-old age group, that number was at 70% who said they needed some form of support for their mental well-being. So of course that's concerning, and of course there's a lot of work to be done, both through providing information to resources, but also providing specific support for mental well-being more broadly.
No, sure. And so as we make sense of those numbers in relation to South Africa, we probably also have to look at the stress factors exacerbating the non-conducive conditions. And I wonder what's come to the fore on that front.
Yeah, that's right. What we saw actually for the 15 to 19-year-old age group, not surprisingly perhaps, is that succeeding in education was a key sort of worry, a key stress factor for them. And that then changed in different age groups. So we saw that issues of violence in the community, but also issues around poverty. So increasing cost of living came out quite strongly. And that's obviously a big worry. But also finally, one of the key areas for young people was around employment. So really around having the skills or being able to develop the skills needed for future employment was a major stress factor that came out this year. And that was similar to some of the previous polls we've done as well. So that mental health support really reflects what's going on in society more broadly and how that impacts on people in an everyday basis, which is why opening up that conversation, breaking down that stigma around mental health can do so much, both from early childhood, but then through adolescence and into adulthood.
Tools and support is vital. And perhaps if you could speak to the basic unit of society, which is the family, and the tools that are available, both in rural and urban settings. We know that families also serve as a foundational well-being. So how does this come to the fore, given South Africa's past as a nation founded on violence? Fast forward to our current socioeconomic conditions as a result.
Yeah, I mean, children's well-being starts at home. That's what we say. And what we've been talking about is a so-called sort of parenting vaccine, where parents and caregivers can get the extra support they need to provide then in turn the best care, the most stable, nurturing care for their children at home. And really that is the foundation of a child growing up. If they can get that stable environment, can get that caring, nurturing care at home, then the chances of mental health conditions developing or mental well-being worsening over years is lower. And that really is a key area that we're trying to push, these parenting programming, parenting support. But it's of course easier said than done. We all know how parents, how stressful it is to look after children in any environment. So when you're in an environment where you're losing jobs, where you're out of work, where there's high rates of violence, of course that's extremely stressful on an everyday basis, and then you have children to look after as well. That's why parenting programs and extra support can really help those, what we'd say, sort of at-risk caregivers, at-risk parents, many of whom in South Africa, as you know, may be extended family members as well. And that's really actually a critical element, really, to start at early childhood development to provide the support that the youngest children need.
Yeah, absolutely. And I wanted you perhaps to just outline UNICEF's holistic response approach, what it entails. We know that there's that issue of GBV in South Africa that you have alluded to as well. how do people who succumb to that ultimately get help? What's the call to action from here on to?
Yeah, I mean, the support really starts in early childhood development, as I said, and it's making sure that parents, caregivers have access to early childhood development centres, because at those centres you can get that support from practitioners. You can get referrals to more specialised support if it's needed for your children, and it also links to parenting programming. So there are apps, ECD Mobi. There's a Cinevoyo teen app for young mothers, and there are others, Parenting for Lifelong Health, which are all programs that can help to provide that little bit of extra capacity, that little bit of extra training, if you want, for parents and caregivers to look after their children. But then that works, through life, through the stresses of life, where it's about engaging young people in the conversation, engaging children, adolescents, in that conversation around mental health. So we saw in the U-Report poll that there is a willingness and a confidence actually among young people to engage with their peers on mental well-being. So around 90% of respondents said they would be happy to talk to their friends about how they're doing, how is their mental health. And that's important, because that early conversation can go a very long way to stopping conditions developing, but also not to take away. There are medical conditions around mental health, of course, that need further support. But it's really opening up the conversation at the family level and among peers can really help throughout the life course.
Toby Fricker will leave the conversation there. Thank you for those sentiments and for your time in the SABC. Toby Fricker is the Chief of Communication and Partnerships at UNICEF South Africa, weighing in as we shine a spotlight on mental health awareness this month in South Africa.